Reporting on the spread of the swine flu and telling you how to protect yourself. This morning we brought in an infectious disease consultant to answer some of your questions, and she is with Ellen McNamara right now. Ellen?
Thank you very much, John. I am joined with Dr. Ganga. Thank you so much for joining us this morning. We know it's early, but there's a lot of concern, obviously, out there right now. What are you hearing, and what's the top question that's coming into your office at this hour?
Well, most people are worried, and we do hear, well, I'm having a fever, and is that a flu? Or, I do not know whether I have a sinusitis or a sore throat, but I don't have a fever. Should I go to the emergency room? And people are kind of very concerned and panicking and going to the emergency room more.
What do you tell them when they're panicking as far as the symptoms? So the big question is, well, yes, I'm sick, but is this the swine flu? So that's right. And what do you tell them?
Well, the swine flu, yes, of course, this is something serious which we have to consider, but we don't have to panic for that because the symptoms are similar like a flu, influenza virus, which we had all these years. But if you have a mild symptoms like sore throat, coughing, sneezing, stay at home. Then call your healthcare provider, and if the symptoms become severe, what do you mean by severe? Like increased fever, increased difficulty breathing, or like more for example, in the kids, if you notice, more of lethargic and confusions. They're not eating properly, dehydrated. If you see any kind of seizures, more sleepiness, and if you see any kind of color changes in the body, then seek medical attention immediately.
Right. Now, as far as the treatment right now, we do have some confirmed cases in the Florida area. Nothing right now real close to home. If we do have a confirmed case, what do you think will happen? Do you think we're prepared?
Yes, we think, because to tell you, yes, we are prepared at this time. But even though we do not know more details about the flu, H1N1 at this time, definitely we can do something to prevent about it. And what we can, for example, if the patient comes with the flu-like symptoms, for what I mentioned, example like fever, sore throat, coughing, sneezing, body ache. So we do the influenza test, and if it comes for A positive, then the test will be transported to the state lab, and then from there to the CDC to confirm the test. So this is what we are doing it. Until then, we will start the treatment with the oseltamivir or zanamivir, and it will be very effective if you start within 48 hours of the symptoms started.
Okay.
Yeah.
So, definitely we unfortunately have to wrap here, but we're going to check back with you later on in the program. And I kind of wanted to talk about the history as well, of the swine flu, because this has happened obviously in the past. So you'll definitely want to stick around for that. We also, of course, want to hear your questions as well. So make sure to go to our website, abcactionnews.com, and click on the banner on our homepage. Send us your swine flu questions, and Dr. Ganga will be here back in that 7 o'clock hour to answer some of them. John?
Here on ABC Action News. In just a few moments, we're going to be joined by an infectious disease doctor from Northside Medical Center. She's going to update us on the swine flu and take your questions. Reporting on the spread of swine flu and telling you how to protect yourself. This morning we brought in an infectious disease consultant to answer some of your questions. She is with Ellen right now. Ellen.
Hey, thanks, John. I'm with Dr. Ganga. Thank you so much for joining us this morning. The last hour we kind of talked about what someone should do as far as their symptoms go if their child is in fact sick, and you just said that if they have a fever, you need to get them checked out, absolutely. But if they have some other symptoms, it might just be kind of a little bug, and you need to keep them home. As far as some questions right now go, historically, swine flu has popped up in the past.
Right.
Why is this one different, and why is everyone so panicked right now?
Well, the swine flu, H1N1 influenza A, is been there in the world since 1918. And we do see some cases, sporadic cases here and there, but we almost saw about 13,7 cases after 1950 to 2005, and just like 6 cases were death. We do not know whether that's for a secondary infection, secondary viral infections, but this time it was more cluster of cases found in Mexico, and we see more deaths. That made more alert, and also it was found more in more cases were found in many countries, like at least like 2 continents. That's how WHO raised the alert to phase 5. That means it is like found in like more than 2 continents. So why it is different? Your question is like, because we are seeing more and more cases and person-to-person spread, and it's more rapid, we are seeing the cases, so we are concerned about it. And we don't have a vaccination for that, and we are still, this H1N1 is under study. All this because of this novel, like because the
Can you hear the balls in there?
We are
It's new.
concerned about. But it's nothing to panic, but definitely we have to take it seriously.
I was going to ask you that. You know, in your opinion, are you panicked? Because pretty much, I mean, we're seeing it all over the news. You know, we're reporting a lot of it, and a lot of people are panicked. But I mean, the normal flu kills quite a few more people just from kind of pneumonia. Is that correct?
Yes, exactly.
So are you panicked personally?
Well, I'm not panicked, but definitely I'm taking it seriously, more alert than before, because for influenza, which we knew how it transmits, and like even like how to take care of that, and what are the risk people who are risk to get more complications. For this, yes, of course, this is a type of influenza A virus. It is more of having a more characteristic like a influenza A virus, how it we all knew.
Right.
So if we are just like being aware and follow a very simple precautions, that's going to be help everybody and the family.
Thank you so much, Doctor, for joining us this morning. We will check in with you again in our next hour after Good Morning America. Thank you. We, of course, also want to hear your questions as well. Go to our website, abcactionnews.com, and you can email us to kind of let us know exactly what some of your questions are, because a lot of questions are popping up as well. You can go to abcactionnews.com and click on the banner on our homepage to send us an email. Thank you, Doctor. John.